My name's Dr Arusha Tanzania, IMPH 2005 from Nigeria. I'm currently a lecturer at the Obafemi Awolowo University, Ile-Ife in Nigeria.
My name is Grace Miheso. I'm a Kenyan. I studied at the Hadassah School of Public Health in the mid-90s. So at this meeting, I'm actually one of the oldest alumni, but very excited to be here.
Well, my name is Adeshegun Fatusi. I am an alumnus of the IMPH program of the Hebrew University in Hadassah, Jerusalem, Israel. And I'm currently a professor of public health at the Obafemi Awolowo University in Ile-Ife in southwest Nigeria.
My name is Ora Peltiel. I was born in Canada. I lived in Israel for a few years as a child and came back much later as an adult. I'm a medical doctor, a hematologist, and internist, and trained in epidemiology and biostatistics. And I have the great pleasure and honor of being the director of the Braun School of Public Health and Community Medicine.
Hello, I'm Dr Nobert Rakiro, a Hebrew alumni of the year 2004-2005. I'm a physician by background, now a public health specialist with a lot of interest in health systems, infectious diseases, maternal and child health, and community health systems. So I'm kind of a little broad.
I'm here to attend the East African Regional Meeting of the IMPH alumni, which is to hold from 5th to 8th of March at the MSTCDC Center in Arusha, Tanzania.
One of the great things is the ability to bring the entire broad alumnus of the Hebrew University Braun School together. We had almost 3 generations, if I'll call it that, because coming out in 2005, I had individuals who, when they hear that, they say 10 years before I came. And talking to Dr. Grace Miheso, she says 10 years before, after I came, after she came, that's when we showed up. And then you look at it, you have a gentleman who was there in 1989. There is a certain cross-generational pollination of knowledge and experience. The level of networking, fantastic. And then being able to understand the regional realities within which we work. So bringing in academia, bringing in the gentleman from WHO, bringing in Francophone and Anglophone African countries, and realizing the different challenges our health systems face, it has been extremely enriching from the level of interaction and networking. That aside, the quality of presentations, we had several PhD students presenting the work they're doing. In our country, there's a region where people usually crack a joke and say, if you throw a stone, you may hit a professor. Well, this was that kind of environment in this conference. If you threw a stone, you'd probably hit a PhD or a postdoc, a gentleman or lady who is a Hebrew alumnus. So the aspiration to academic excellence, even for those who may have been slacking, that was present. The richness in programmatic experience and insight was broad and vast. And bringing in development partners, alumni who work in development partners, then you get to see the entire continuum from implementing partners, government entities, and funding agencies. This is the broad spectrum that our public health practitioner needs to internalize when they're doing their research or coming up with proposals or going in for positions of authority. So for that, again, it expanded the minds and the insights of those who are present. And then, of course, the great humor of our lecturers. They are individuals that, every time you go out, you deal with stuff. When you come back, you almost feel like this is my teacher again. But he's a teacher who has become a friend. You still sense that academic excellence in them. The attention to detail, it still reverberates through their character. Their love for the world, tikkun olam, it keeps reverberating when you're there. And then the choice of Arusha Tanzania, my goodness. My colleague, the alumni, Dr. Nobert, organized perfectly a team of adolescents with great insight, but speaking at their level, speaking to people who are responsible for programming. And just to give you a tip or a pointer in terms of how effective that was, not only did these 4 young ladies and a gentleman get an invitation from WHO, but one of our USAID colleagues actually said that these are individuals that need to be included in subsequent conferences. So there have been dividends all around.
I think we chose Adolescent Health because adolescents are at the crossroads between children and adults. Children have been a great focus of programming and research, especially in sub-Saharan Africa.
I came because I was invited to add a little different perspective to adolescents, and they asked me to speak on the subject of what older children, that is adolescents, have in common with older adults, that is geriatric patients, because I'm a geriatrician.
You know, adolescent health is such an appropriate theme to consider for a meeting of African researchers, African health workers, particularly in East Africa.
Actually, in where I work with one of the big multilateral organizations, USAID. And just last year, we had a lot of focus and attention, even with our partners, to discuss what are they doing in adolescents. You know, just to strengthen their programming and just ensure that they're really meeting the needs of the adolescent. So this topic was excellent because we were able to just find out different ways that people are programming and really discuss actual things that are happening within the community.
And as we see the under 5 mortality decreasing all over the world, we have to then look at the next risk group. And definitely adolescents are a risk group in terms of sexual and reproductive health, HIV incidence and prevalence.
And Africa particularly needs that because Africa is the youngest continent, and Africa is the place where you continue to see the population of adolescents growing over the next couple of years. So it's a theme that's so appropriate, it's so context specific, and it's something that's going to launch everyone who had come to this meeting on the pathway of beginning to think more and doing more regarding adolescent health.
And if we can impact their health and their health behaviors at that age, we will make them more healthy and more productive adults. I think that the slogan, One World, One Health, is a very appropriate slogan right now. I think that it doesn't matter if we're talking about health of animals or health of people. It doesn't matter if we're talking about health of communities or health of nations. The globalization process has made us all impact one another.
Without the adolescents, there is no future for all of us. So we must think about adolescents, we must work with adolescents, we must commit resources to adolescents, and we must ensure that we secure the health and well-being for adolescents.
Well, to thank all participants for finding time out of their busy schedules to be here, and to the organizers, Maureen, who has been fantastic, Yehuda, who has always been ever so articulate, Ora, quintessential. We thank you all for everything you've done to make this happen. We are indeed very grateful.
And again, kudos to the team that put it together and the ones that funded it. We truly appreciate your sacrifice and your investment in this. The alumni from the Braun School and these peer scholars, while we're preparing and adjusting ourselves for a life where AI changes things, the world better be aware. There is a group of alumni that are coming out that you'll need to contend with, and I'm glad to be part of it.